It's a Northwest News Radio weekend. Now, back to IRG's Health Talk.
Our next guest, Dr. Doug Backous, neurotology and skull-base surgeon with Puget Sound ENT. This sounds like some serious stuff we're going to talk about, Shannon.
Yeah, just recently, they came out with over-the-counter hearing aids, and Dr. Backous specializes in a lot of things, but one of his passions is hearing for all. So he's going to talk about these over-the-counter hearing aids that you can go in and purchase just like you used to buy, a cell phone or, anything over-the-counter now. But there's things you have to think about, and there's things you have to look at. So he's going to talk about over-the-counter hearing aids.
All right, let's listen in as Dr. Backous talks with Shannon O'Kelly.
Dr. Backous, welcome to Health Talk. How are you?
Doing well. Glad to be on. Thanks for having me.
I always enjoy talking to you. You have a kind of a specialty area in your practice, but tell our listeners about Dr. Backous and your practice, your training, and more importantly also, you have some political role in your organization. I want to hear about that also. So give us the lowdown.
So I am a neurotologist. So I'm a boarded ENT surgeon who did a 2-year special fellowship to do intracranial surgery in the skull base. So I take care of tumors where the spine comes into the brainstem, and have a specialty interest in hearing and cochlear implants, where we bring hearing to people who have no natural hearing in that ear. And I am the president-elect of the American Academy of Otolaryngology Head Neck Surgery, which is the national academy for all ENT surgeons. And we've been very active in the over-the-counter hearing aid discussion and the final regulations.
Yeah, that's what we want to talk about today. Just recently, maybe in the last couple weeks, you can now purchase over-the-counter hearing aids. That means the general public has access to hearing aids over the counter. But tell me what you think of that.
Well, on August 16th, the federal government released the final review that as of October 17th or last week, you can buy an over-the-counter hearing device. These are self-fitting devices, much like getting a pair of glasses over the counter when you go through the drugstore shopping line. The FDA has approved these. They have to be self-adjustable by the person. They have to actually have an output limit that maximizes at 111 decibels. And that's a bit concerning to us because 111 decibels exposure to the ear could cause hearing loss if exposed for over a couple of hours. The FDA is not requiring that people have a medical evaluation. So when you have symptoms like one-sided hearing loss, one-sided ringing, there are red flags that are actually in the labeling that say you should be evaluated by an ENT doctor.
Yeah, so basically kind of what's going on here is there's better access and maybe better affordability for that person that might think they have some hearing loss. But again, hearing is such a complex process. Tell us about that process and why it's important to understand those red flags. If I'm at home and all of a sudden I think, I'm not hearing very well, can't hear the TV. You talked about red flags, but talk about the hearing process, how it works, and why you should probably get tested before you go in maybe to do something over the counter. I'm just thinking that.
Absolutely. And the over-the-counter hearing aid legislation only pertains to people over the age of 18. So children can't be fitted with these. And it would be much like trying to buy a car without ever looking at a car. If you say you're going to put a hearing aid in your ear without knowing what your hearing actually is, it may be something entirely different, something as simple as earwax, which doesn't allow sound to get through the ear canal. Or you could have a problem in the middle ear where the ear bones vibrate to amplify sound to your inner ear. And that's something that is surgically correctable. There's also issues with the inner ear or the neural part of your hearing where the sound is delivered by those ear bones. And if that's defective, those are the people that tend to do the best with the hearing devices. But there's low frequency hearing loss, there's high frequency hearing loss, and these over-the-counter devices aren't designed to pick out specific types of hearing loss. So one of my concerns is people may choose the cheaper option, be poorly fit because nobody's really fitting them, and then give up on the fact that they could actually improve their hearing. Why is this important? Well, in younger people, it's very important in the development of speech and language, but what we're learning now is the single most high risk factor to early onset dementia is hearing loss, even more than diabetes and cardiac disease. So it does have an impact on potentially your future higher order functioning of your brain that could lead to dementia. So being well fit is a really important component of your hearing restoration.
Good. We're going to take a little break and come back, and I'd like to further discuss that dementia and maybe talk about some stats regarding hearing loss. Let's just take a break. We'll be right back.
Shannon O'Kelly and Dr. Doug Backous coming up next. More of their conversation right after this on Northwest News Radio.
It's a Northwest News Radio weekend. This is IRG's Health Talk. Back to Tom Hutler and Shannon O'Kelly.
Northwest News Radio, and it is time to continue our conversation with Dr. Doug Backous and Shannon O'Kelly.
Dr. Backous is talking about hearing. It is important that people hear. We know that young children, that if they have hearing deficits and it's not picked up in time, they have learning deficits. But you just talked about something that's interesting. We have this huge experiencing in our population as the grain of America, so to speak, dementia. And you talk about hearing loss and contributing to maybe early onset dementia. Why is that? What do they know about that loop there?
Yeah, the initial studies were done by Dr. Frank Lynn at Johns Hopkins University. And basically, he went back and looked at a lot of population data following people through the Framingham study, the Baltimore Center of Aging study, where they just follow people throughout their life to see what type of conditions were developed. And as we've gotten a handle on cardiac disease, we're getting a better handle on cancer, people are living longer, and dementia is becoming a major issue, by the way, that's going to impact funding sources such as Medicare. And it turns out that when you look at risk factors and early onset of dementia, the most tightly associated risk factor is hearing loss. And the Lancet, which is the British medical journal that's very prestigious, put out a 2-part review last year where they have clearly shown that they validate that relationship, but also that if you prevent it, so if you get hearing amplification earlier, whether that be a hearing aid, a cochlear implant, whatever you need, then your chance of getting dementia statistically goes down. And this has a huge impact on all of our quality of life as we seek to live longer and be healthier. I feel like it's a human right to hear. I think if you want to go to church, you should be able to go to church. You should be able to go to the school. Over-the-counter devices are a way to get people online. The problem is some of them aren't very cheap. And there are hearing aid options that are coming in now that are actually cheaper than the OTCs. So I think this is going to push a good discussion, and I think more people are going to be able to have access to hearing.
Yeah, I'm just, as I'm listening to you, I'm thinking to myself right now, I'm a product of the late 70s, the 70s and the 80s, I don't ever remember, wearing hearing protection. That just wasn't very popular. What are some signs and symptoms of maybe hearing loss that people should be aware of?
Yeah, I think you see it in a couple of different levels. So in folks that are getting more senior in their years, you see them starting to isolate themselves. Mm-hmm. I think in our age group, the very young, is that we're starting to see people getting ringing in their ears. They're starting to have communication problems with their spouses. And when I say really young, I mean 45 to 70. Mm-hmm. The younger age groups, interestingly, have access to much better hearing devices than we had. The 3 words we always shouted at a high school dance was "turn it up."
Yeah, exactly. Yeah.
I think what you can do now is you can basically turn it on, turn it down, noise cancel. Noise canceling doesn't mean you should turn it louder without background noise. It allows you a higher fidelity of sound at a lower volume. Hearing loss is time-based. It also doesn't go away. So at a certain decibel level, which you can look up quite easily, anything above 85 decibels starts causing hearing loss. If you get a hearing loss, a sensory hearing loss, and you take care of your ears for 10 years and then you abuse them again, you're just going to add to that hearing loss. It doesn't recover. So it's an additive process, and you've got to be very careful.
Yeah, excellent point. Hearing is so important for everybody. But, we're out of time here, Dr. Backous. Again, I want to thank you. It's good that over-the-counter products are out there for affordability and access to general population. But it's important that you might want to get some kind of audiology test or some kind of workup to make sure you understand what you're purchasing. Is that fair to say as we wrap up?
Yep, and if you try a device and it doesn't work, that's only the beginning of your process.
Dr. Backous, again, thank you for your time.
Have a great day.
Thanks to Dr. Doug Backous, neurotology and skull-based surgeon with Puget Sound ENT. Go to PugetSoundENT.com to get more information. Back with our final segment after this time out on Northwest News Radio.